Hi guys, let us talk about coronavirus, how this pandemic is going to get over, or what is this happening in our country, in our world, this can get over. The simple answer is that you get coronavirus. You get coronavirus and this pandemic is over. Surprising, right? I'll explain to you what is that. Let's say, I'll give an example. This is a coronavirus, okay? This is a coronavirus that is actually causing you the problem. This is the whole pandemic. Now if this coronavirus enters my body, how it can enter? It can enter to my eyes, it can enter through my nose, it can enter to my mouth. It's a droplet infection. If a person is having coronavirus and he sneezes or he coughs, the respiratory droplets, the saliva, the secretions will be floating in air. And if I breathe or he sneezes very near to me, and it will enter my body and I'll get the infection. So this is a coronavirus. It enters to my body. Now my body is very new to this virus. My body has never seen this virus, so I'll get sick. So whenever a virus or a bacteria, when it enters your body will sense it. It will sense it's a foreign body and it will try to kill it. So whenever this virus has entered my body, my WBC, that is white blood cells will be activated and will come and try to kill this virus. So for this process, for identification of this virus and production of antibodies, it will take you around 3-4 days, maybe 5, 6, 7 days, around a week it will take you that for production of antibodies. Since this virus is new, my body is not accustomed to this virus, so my body has to develop the antibody. Right, so let's say this is the antibody that has been developed by my body against this antigen. So the antibody has been produced. Now it will come and it will clip and will make this virus inactive. But in the process, our body is very smart. It will produce another antibody, same as of this, but it will store it in its own system. So that whenever this antibody whenever this antigen again will infect me in the later point of my life, this antigen is always ready. That means the antibody is always ready for action against the antigen. I'll say it again. This is a new virus. It entered my body, will cause me damage. My body will identify this antigen, then it will produce some antibodies against it. So it will destroy the organism. But in the process, my body will also keep some antibodies for further exposure. So whenever I get exposed later in my life, my body is ready with the antibodies. Okay, that's the main mechanism of how our immune system is being developed, or how our immune system is developed. Yeah. So the best way of coronavirus is that you have the antibodies produced. So coronavirus is a very new virus, so obviously our body doesn't have the antibodies produced against it. So if you get coronavirus, your body will make the antibodies against it. Yes, now it's a very strange thing that I'm asking you to get infection of coronavirus so as that you get the antibodies and then you're saved. Yes, it's true. 80% people who are infected of coronavirus, 80% of people who are infected of coronavirus will not require any medical treatment. They will require no medical treatment. The next 20% will require medical aid. 15% will require mild to moderate medical care, and then the rest 5% will require around intensive care unit. Now, the cases, the number of people who are dead is so high because our system, our country, our world is not ready to have so many ICU beds, so many doctors, so many healthcare professionals. So they're not used to getting so much of cases in a very short span of time. If our system was accustomed to get it, or they have enough ICU beds, enough hospitals, enough medical staff, then the mortality, that is the number of people who are dying because of coronavirus, will be very, very less. Okay, so the main idea behind is that you need to have the antibodies in your body so that you can fight against it, because our body will make memory cells for that. Yes. So it's not a very wise idea to get infected of coronavirus and then have the antibodies produced in your body. So what is the next step that you can do? If you don't want to use this technique, then what is the next step? Wait for the vaccines. Wait for the vaccine to be developed. Now, how this vaccine actually work? The vaccine is going to have some antigen, that is, it will have bacteria, or it will have the virus which is not very strong to cause you a disease. It will be not that strong to cause you a disease, or it will make you sick, but it will be strong enough to produce a antigen antibody reaction of this thing matter. You are introducing the antigen from the outside, is introducing the virus or bacteria, and then we are telling our body to make antibodies, but this has been genetically and under lab circumstances, it's been made in such a way that it is not that strong enough to cause you damage, but strong enough to cause your body to develop this thing, antibodies. That's the main mechanism of vaccination. So you need to wait for the vaccination to develop against coronavirus. Now, this virus producing vaccine for coronavirus is actually very hard, not just of coronavirus, for any virus, because the virus have a tendency to change their shape, every now and then. So it becomes difficult for the antibodies to identify the virus. That's the reason you are having common cold frequently. It's not that you're having common cold just once. You're having common cold frequently because the influenza virus is changing its shape every now and then. So let's say I had coronavirus, I had common cold, that is influenza virus infection, let's say for 1 month back. Today I may have influenza infection again, because I will not be infected with the same virus that caused me infection 1 month back, but I will be having infection today by the same influenza virus, but the virus has changed its shape. That is the main problem with virus. That is the main problem with coronavirus as well. It is changing its shape and the outer lining. If this part has been changed, so the mechanism, it won't fit properly. That's the main problem with virus, and that's the problem that we are not able to make the vaccine so easily. That's the main issue. So we don't want to get infected by coronavirus. We don't want the vaccine. We not want the vaccine quite fast, but it has to go through many trials. It has to go through production. Then again, it has to go to the grassroots level, to every people, every household, every school, every village, every community. It's not a very easy task. We have to vaccinate all over the world. It's not a joke. So that's the reason you should opt for a third technique, that is social distancing. You don't get the infection in the first place. If you don't get the infection in the first place, you won't be developing the antibodies. Agreed. But if you don't have the infection, you don't need to have the antibodies. So maintain social distancing around 6 feet from one another. Wear a mask, preferably. If you're working in hospitals, you're a nurse, you're a doctor, you're a medical care professional, any healthcare professional, or you're taking care of a sick person, in that circumstances, please wear an N95 mask. These masks are well fitted to your nose and mouth, and it gives you very good protection. For average people, average public, you don't need to wear an N95 mask. You just wear a mask which is made up of cloth. Very good enough, and use that mask in conjugation with good hand hygiene. Your hand hygiene has to be very good. Wash your hand often, and do not touch your nose, do not touch your eyes, and do not touch your face, a facial part. So this is how you can manage till the vaccine has been developed, or you itself get coronavirus infection, and then you develop antibodies against it. So this is so now one very important question. Let's say you are infected with coronavirus. What are the symptoms that you will be seeing that you're having infection with coronavirus? You will be having fever. Next thing, you will be having chills. Chills, it means all of a sudden you're feeling very cold. Then you will be having cough. You might have chest pain. You might have difficulty in breathing. You might be tired. You might be having running nose. You might be having congestion in your nose. You might be having shortness of breath. All these are symptoms, okay? Now these symptoms, yes, it does match with symptoms of common cold, common flu. So how would you differentiate this common cold or coronavirus? You can't. With the symptoms, you can't. The only thing, you have to get tested. So let's say you have these symptoms, then what should you do? Go to the hospital? No, do not go to the hospital. Stay at your home, because the hospital, the doctors, the healthcare professional, the nurses, the paramedics, the person who are handling that people, the lab workers are very tired. They're like, there's over congestion. So stay at home, and as I told you, 80% of people who are infected with coronavirus will not require any medical treatment. You just stay at home, sleep, take rest, maintain social distancing, do self-isolation, practice hand hygiene. Whenever you sneeze on your elbow, you should wear a mask, and the people who is coming to care you, please tell them to maintain a distance, tell them to wear a mask. And now, if you're staying at home and you are having some symptoms, then you should immediately rush to the hospital. It's very important that you immediately rush to the hospital. What are the symptoms that, if you find that you're staying at home, then you should rush to the hospital? First is that you're having shortness of breath, you're not able to breathe, or you're having difficulty in breathing. Okay, you're just taking short breaths in this pattern, or you're having difficulty in breathing, you're having constant chest pain, or you're having just chest pain, go to the hospital immediately. You are having confusion, you're not able to think clearly. Okay, then the next thing is that your lips, your face is turning bluish. That is very important, that your face on this thing is turning bluish. And another thing is that you are drowsy. You are just drowsy, you're sleepy all the time, or you're not able to stay awake. You're all the time you're sleepy. That means there is CO2, carbon dioxide, increasing in your body. So I'll repeat again: chest pain, difficulty in breathing, shortness of breath, you are drowsy, your lips and face is getting bluish, you're not able to think, you're having confusion. At that moment, you should immediately rush to the hospital. That means you are developing serious complication. So this was a short video about coronavirus, and please understand that eating a certain food, or taking this medication, or eating that will not increase your immune system. Okay, there is nothing that can boost your immune system. The only thing is that you can make sure the immune system is working optimally. There is no drug, there is no medication, there is no fruit, no vegetable that will boost your immune system. You cannot boost your immune system. You can make your immune system work in its optimal manner. So I'll just summarize one more time. This is the new virus that you have never been exposed. It will enter your body. It will take some time, around 1 week. Your body will identify and will produce antibody, but at the same time your body will produce some extra antibodies and keep it for further exposure. That is known as memory cells, that whenever the next time you're getting infected, your body will not take time and you will not get sick. Your body already has the antibodies produced for it. So the another thing is that you take vaccination. Vaccination will have the virus or the bacteria, that is the antigen, but it will be not that severe that will cause a disease, but will be enough severe to produce a immune response, so as that your body will produce the antibodies. And the third thing is that you should maintain the social distancing. Wear a mask, wash your hands, maintain social distancing. Do not cough onto someone's face, or do not cough blankly or sneeze. Cover with your handkerchief or cover in your elbow. And if you're sick, you have the symptoms of coronavirus, stay at home. 80% of people will not require medical treatment, but there are some signs and symptoms that in which you need to go to the hospital. These are some serious conditions. I'll repeat it again. You're having difficulty in breathing, you're having chest pain, you're having shortness of breath, you're having confusion, your lips and face is turning bluish. So these are the symptoms. And also you are having drowsiness. That means you're drowsy, not able to maintain awareness. Not awareness, you're not you're all the time you're sleepy, you're drowsy, you're not able to stay awake. If this is the condition, immediately go to the hospital and tell your co-workers, family members, friends, relatives to maintain a social distancing if you think that you have the coronavirus infection. So I hope you can try to understand and try to fight out with this disease. And if you have some confusion or some suggestion, you may leave down in the comment section. and I hope that you do maintain social distancing, wear a mask, and take care of yourself and take care of people. And please, one request: if anyone is having coronavirus, please do not disclose them on the social media that this person, so and so person, naming this age and address. It becomes a privacy issue for the person. If a person is infected, please treat them with respect. Things might that you or I might get infected tomorrow, so I don't want someone else to treat me in a bad manner. So it is like give and take situation. So if you don't want someone else to treat you bad, you should also treat them with respect. So this was a short video about coronavirus. I hope you take good care of yourself, and yeah, that's it. Thanks. Bye. Take care.